I'm Virginia Doran, your host for To the Point, generously produced by the American Acupuncture Council. And today I'm delighted to have as my guest Ivan Zavala, also known as Ivan Cloud. Many of you maybe have seen him and had questions answered by him on Facebook. He is a international lecturer and teacher, and he teaches at the Chicago College of Oriental Medicine. And one of his specialties is advanced diagnostics. He's taught himself to read clinical Chinese or medical Chinese, and he, has access to texts and things that that maybe your average practitioner would not have. So I would like to let you know that today the title is Unfolding and Decoding the Disease Mechanism. And Ivan, welcome to the show.
Thank you so much, sir. I'm glad to be here.
Well, it's a delight to have you. So I know that you're well versed in the classics. Can you tell us, what do the classics say about disease mechanism and the significance?
Well, the question is in a certain way simple and also complex, right?
Yeah.
Simple in that, in a certain way, the classics define to us the concept of disease mechanism. So without the classics, there wouldn't be a conception of disease mechanism at all, right?
Mm-hmm.
So in a certain sense, the classics to us define to us disease mechanism. And there's different schools of thought of disease mechanism, right?
Mm-hmm.
And so why is that even important, right?
Mm-hmm.
Well, the reason disease mechanism is important is because from disease mechanism, we understand the etiological imprint, right?
Mm-hmm.
So first, when we look at, we have to ask ourselves, what is disease mechanism, right? Or what the Chinese call Bingji, right? Like what the pathomechanism is another popular word to translate that, right?
Right.
But I prefer disease mechanism because it's just more easy to conceptualize, right? Than pathomechanism, right? Because you have to know the word pathos. And but disease mechanism, what it is first in Chinese medicine, we are often told that Chinese medicine treats patterns, right? So
Mm-hmm.
a person has an issue, then we try to decode the constellation of symptoms they have, and then we put that into boxes, right? Like little coordinates. And those coordinates, we call those patterns.
Mm-hmm.
So if a person is bloated, has low appetite, kind of soggy pulse, diarrhea, we call that a spleen chi vacuity, spleen chi deficiency, right? In other words. And that's what we call them. We diagnose that and we treat that. And hopefully from that, they get better, their complaint, right? But that's actually trying to treat what pathomechanism had unfolded. Patterns are, in other words, a fixation, right? A fixation in the disease process, right?
Mm-hmm.
The disease mechanism is how those patterns unfolded, right? How they came to be, and how those patterns are going to unfold into the future, right? So
Mm-hmm.
what other patterns they're going to lead to. And
Mm-hmm.
this is important, I think.
Like disease along a continuum.
Yes, exactly. And so from that aspect, we could predict, right? Because patterns, we could predict the present. So if a person, because that's what Chinese medicine does, is really well. Person comes to us, and whatever they're presenting with, we diagnose them at the present moment, right?
Mm-hmm.
The power now, in a certain sense, right? But from a Chinese
Mm-hmm.
medicine perspective. And we treat that, what they're presenting with. And so we treat in the present. But the disease mechanism allows us to look at the past of the condition, along with the medical history of a person, right?
Mm-hmm.
And then also be able to prognosticate their future.
Mm-hmm.
In regards to the disease
Their health, yes, I
process,
know.
their health, not their destiny. Although some might argue that if you're able to diagnosticate the condition, you're able to diagnose
Right.
the future, right? How many children they have and stuff. And actually, that is part of Chinese medicine as well, but it gets more into the esoteric
Right.
aspects, right? And that's actually perfectly fine. And so, what I've been focusing on, like my classes and advanced diagnostics, or even bringing into acupuncture, because acupuncture we're often taught in a kind of simplistic manner, at least in internal medicine, right?
Mhm.
In internal medicine, a person has this condition, we use this points. That's kind of it, right?
Yeah.
Based on those patterns we see. But deriving pathomechanism in like points and pulses, that's often I feel it's not emphasized, right? What is mostly emphasized is just a certain part of the continuum, right?
Mhm.
And really, my emphasis is be able to develop practitioners have a better sense of prognosis, right? Because patients often come to us, they ask like, doc, how many treatments do I need? But besides just giving them like a treatment plan, I mean, you could do that maybe without the prognosis, right? It's based on experience, and maybe you want to need a certain treatment course, right? You experience 5, 10 treatments, or just a dose of acupuncture, right? But the prognosis allows us to, especially in chronic and in internal medicine conditions, be able to ascertain whether how much of an impact you could affect that condition, and how long it's gonna, and you could stage the disease process, the treatment
Mhm.
process, because when I talked about the past, present, and future for a person's condition, especially the future aspect, um, when you give a treatment plan, some people just focused on the present, right? So they're like, you need a treatment right now for the kidney chi deficiency. I'm going to see how that progresses. Well, actually, from a prognostic standpoint, if they have like an internal medicine condition and you see all these patterns, you can't treat all those things all at the same time. Sometimes you have to
Right.
stage things.
Mhm.
I had recently I saw a patient with uh, with tuberculosis, right? But it was not
Mm.
myobacterium tuberculosis, right? It's called like difficile or something like that. It's like a different type of bacteria, right?
Mhm.
And for her, uh, I wanted her to get into. I wanted to basically treat that that almost like cold in her kidneys, right? From a
Mhm.
Chinese medicine perspective, but I wasn't able to do that because she had all these hidden infections in her lungs, right? And she also
Ah.
had, so I have to basically stage the treatment. And not
Mhm.
only that, for something of such grave condition, right? She was
Mhm.
basically, from a Chinese medicine perspective, I diagnosed uh, like dead lung. That's a Chinese medicine
Mhm.
disease, right? A dead
Mhm.
lung or an expiring lung, right? And she also had like asthma and stuff like that. And for that, for me, I had to ascertain the prognosis, right? And how well I could actually affect this condition. For example, one aspect I looked at is for a person with such a condition that could kill them, right? That could actually
Mhm.
kill them, and are kind of at death's door, right? Or some just
Mhm.
even an autoimmune disease that's progressively degenerative, right? I have to ascertain how she's going to get affected by other factors other than the disease. Which I mean, like in Chinese medicine, we think what drives disease is obviously celestial patterns, right? Like the weather and stuff like that, right? The season, and then of course the movement of the disease, right? And sometimes the seasons and the celestial motions, right, which is really
Mhm.
the weather cycles and stuff like that, drive the disease in a certain way. It could make the disease incubate, the disease flare, and actually there's also a seasonal aspect to a person's condition. So yes,
Sure.
so there's a winter. When we're in winter in December, we say seasoning that's winter, but sometimes people are in winter mode during summer, their body, right? Their
Because
body
they're
is
in
like
air conditioning or for other reasons?
air conditioner, and their disease. Their
Ah.
body's just hibernating, they're
Mhm.
cold, they just wrapped up. The image of them is like winter, right?
Mm. Mhm.
And so when that is presented in conflict with the seasons and stuff like that, we have to ascertain ourselves, well, there's obviously an imbalance of the body in response to the season. And you also have to ascertain that along with their condition. So for example, I'll give the example. With the tuberculosis patient, for example, she had obviously a lung condition, and we put that under metal, right? Metal.
Mhm.
In Chinese medicine, obviously, for those that don't know,
Sure.
The lungs relate to metal phase, the element, right? And what we say, what scorches metal naturally is fire, right? Fire melts metal, right?
Mm-hmm.
So if a person presents with any fire signs during this disease process, it's a very bad prognosis. So, for example, during summer, they could get worse. The aging tells us for a lung condition, during summer, the disease will aggravate, or the person may die, right? But it's not just seasonal; it's also the pulse. For example, the whole pulse could be rapid or big or surging, or the right side might be rapid in the disease process. So the first thing I look for this person to prognosticate where they are in their clinical picture is that rapid or surging and rapid pulse. Glad, luckily they didn't have that. Some said, okay, if they don't have that, they're still pretty bad, right? As the diagnosed expiring lung, but it's something that we could actually mitigate a little bit better. Because if they have the rapid pulse, I'm a lot more worried for them, right?
Mm-hmm.
Because the disease process is something that is very aggressive, right?
Mm-hmm.
So sometimes in Chinese medicine, what I'm saying is we could tell if a disease is a very aggressive, if our treatment is going to be enough, right? Sometimes in tumors and cancers, we could say, okay, this is very aggressive cancer from a Chinese medicine perspective, not just because of the stage of the cancer from a Western perspective, stage 1, stage 4, because a person may have stage 2 cancer versus stage 4, but a stage 4 cancer patient might be more robust, right? Versus even a stage 1 cancer who might, yes, their metastasis is less, but the patient is weaker, and the
Mm-hmm.
disease process is that it's actually going to have more of a chance of injuring the stage 1 person, right?
So depending on the individual constitution?
Individual
Yeah.
constitution and the state of the disease aggressiveness from a Chinese
Mm-hmm.
medicine kind of energetic perspective, right?
Yeah.
And it's energetic, but it's also tangible in the sense of we look for concrete signs, because um, Chinese medicine is basically based on. I always tell people that Chinese medicine is no different than Western medicine. Let me tell you in what way I mean that. Obviously, we have different ways to treat, to talk about a certain kind of disease, but it's not so much different in the sense that our our goals are the same, right? Often people think that Chinese medicine is somehow just, I mean, we are focused on other aspects of the whole individual, right?
Mm-hmm.
Like their mind, their heart, and their body, right? And even Western medicine now they're going into certain realms like neuropsychology, neuroimmunological psychology, those all those words, right? They're kind of combining departments, right? But in Chinese medicine, that's always been our kind of motif, right?
Mm-hmm.
And but our goals are the same. And in fact, often what I'm trying to emphasize that often what is taught is pattern-based medicine, but Chinese medicine has also always focused on disease as well. So if a person comes to you with a certain disease, and there's a lot of different diseases, sometimes we don't necessarily even have to treat the pattern, we treat the disease. Sometimes we treat the patterns that we see, and sometimes we treat the pathomechanism, the unraveling of the process,
Mm-hmm.
in order to basically be able to ward off what led to the patterns and what those patterns are going to unfold to, right? So it's kind of like a decoding. And sometimes it sounds very complex, but once you actually know how to actually look for certain uh, signs that are ominous, certain signs that are auspicious, then we were able to prognosticate like different stages of treatment, right? And then signs that seem auspicious sometimes become ominous, and signs that are ominous sometimes seems auspicious or become auspicious, right? So it's kind of like yin and yang, yin within yang, right? Or yang within yin, and yin within yang, right? Or I
Mm-hmm.
think I said that correctly. Um,
I have a question,
yes,
because it seems, with some conditions and individuals, you're going to treat the root of the problem
yes,
instead of just chasing the symptoms.
exactly.
But there are times where you have to, stop the symptoms so that the person gets some relief, or, something like an infection doesn't progress anymore. And I don't know if it's even fair to ask if you can put a number on it, but like frequently, or in your practice generally, how do you treat, or yeah, I mean, obviously it's based on the individual, but would you say that more often you're treating the constitution on, say, a chronic illness, or are you getting a lot of people with acute conditions that you have to take care of before you can get to, they may have a terrible flu or something like this before you can actually treat their diabetes or whatever it is that they have.
Yeah. Um,
And is there any kind of rule of thumb of when you would treat the symptom before the branch before the, what is it, the bend before the bow before the bend,
yeah, exactly. I personally do believe that, I mean, you should treat the person where they're at, right? I recently saw a case where a person had horrific like plaques in their legs. I saw it on Facebook, right? It's just like it looked like stasis dermatitis, right? But a very severe case. I mean, I'm not a dermatological expert, but I do focus on disease process. So it looked like stasis dermatitis to me, right?
Mhm.
But very severe, right? And and this person obviously was very depressed because of their condition. And I saw, and obviously the main issue is the skin disease, right?
Mhm.
And then some people were telling, well, you have to treat the depression. Well, the depression is only because of the skin disease. You treat the skin, and the depression will go away, right? And some people were trying to focus on the depression, but the depression is a secondary or tertiary sign
Mhm.
of their skin, right? Of what's of the disease,
Right.
right? So in a certain sense, if somebody went and tried to treat the depression, that'll be I think that'll be uh what's the word, completely contrary, sorry about that, so completely contrary to the patient, right? Because their concern
Mhm.
is the skin disease, right?
Well, in that
Now,
case, maybe you could treat them both at the same time.
yes,
Hence, yeah,
yes, yes,
because
but some
I
people
mean,
are
it
just
would
focusing
certainly
on
have
the
an effect.
depression
Right,
itself
right, right, and
completely.
yeah, denying the symptoms, the physical symptoms, yeah.
And so I'm always like focused on meeting where a patient was at, which is usually a physical tangible perspective, right?
Mhm.
And some people immediately try to go to the root, right? Well, sometimes it's hard for me to tell what exactly is a root, especially when there's 5, 6 processes unfolding, right? Usually, I kind of have a sense of what the root is, right? But like I said, with the tuberculosis patient, I was only able to maybe begin to treat at the third process of disease. I couldn't even get back to right, because there's like one process, second process, and a third process that are
Mhm.
basically driving the disease, right? And so basically, what I'm gonna have to, for a patient like that, I'll have to basically begin to step 3 and begin to push back to 1, right? To what unfolded the disease, which was the kidney cold, right? But I wouldn't be able to treat that because if I try to warm something like that up, I might actually introduce heat to the body, and there's already kind of like a hidden pathogen of heat,
Right.
and I might actually drive that, even though the cold stasis is leading to the heat. But I have to kind of treat backwards sometimes, right? So I wouldn't be able to get to the root right away because
Right.
it actually might make the person worse.
Right. Very few people are just solely cold. They have pockets of heat usually somewhere.
Yes,
Yeah.
exactly. So sometimes, so basically, I believe in treating the symptoms um, as a primary objective toward the patient, but always be focused on what is, yes, if at best possible, what is causing the unfolding of the symptoms. If we just treat the symptom symptomatically, we're no better than just giving a person pills. And there are
Mhm.
people that I see do that. Have itchings, take this. Have pain, take this. No, what is driving the pain, right? And if the pain is not resolved, what is it going to lead to, right? And and I often see this also like I saw people we present with a UTI. So some people will be, oh, just get rid of the UTI right away, right?
Mhm.
And the person had like a pale tongue, a slow pulse, right? Which is kind of like cold or and then like a
Mhm.
soggy pulse, stuff like that. So they may have like cold damp or stuff like that,
Mhm.
right? whatever the case is. And then they'll preserve and give like prescribe a cold bitter formula like Longdan Shegantan.
Mm-hmm.
And lo and behold, for those that don't know, it's a very strong inflammation clearing formula, right? But to give that formula, for those that don't know, you have to have very inflammatory signs, right? The UTI is not enough from a chain medicine perspective to give that formula. You have to
Right,
have
right.
the whole picture, right? And the person, lo and behold, does get better from the Longdan Shegantan because it does clear the heat from the cold damp.
Right.
But
For
from
someone
my
who maybe
perspective,
gets reoccurring, it may not be.
reoccurring, but you could also actually aggravate the disease. So you actually might bind the cold damp, you might bind the heat. So years down the line, you actually might be part of the process of why this person got an autoimmune condition, even cancer
Mhm.
from my perspective, because you didn't protect and honor what their body was telling you. You just gave it based on a symptom that had no pertinence to their whole clinical picture, right?
Mhm. Yeah.
And so sometimes so what I'm saying is just treating the biao at that moment without actually treating any aspect or consideration of the root, right, will be completely unwarranted, right?
And because time is an issue, what would be your parting words at this moment for, like your students or, people who are really trying to unravel, the disease mechanism in Chinese medicine? What's your best advice of how they can improve their skills and understanding of that?
My I guess my final parting words per se will be that is that just ingrained in your head that Chinese medicine is not just focused on patterns. We're focused on disease, right? And what that means is that if you're able to identify a disease from a Chinese medicine, so you have to actually acquaint yourself with what a
Mhm.
disease is in Chinese medicine and be able to treat based on that. You actually might be able to approach complicated conditions from a very simple manner. So it actually makes things sometimes simple because you're able to identify disease and you just treat the disease from a Chinese medicine perspective.
Well, yeah, people have to look at it as it's not a static condition. It's ever evolving, changing situation with
Yes,
multiple factors affecting it. Yeah,
yes. Like
yeah.
for one example, like if they have erosion of the throat, right?
What's
They're
erosion of the throat?
like they have maybe sores in their throat is raw.
Oh,
They
mm-hmm,
might have like a herpetic lesions.
mm-hmm.
They may have like a whole body itching. Their eyes are red and inflamed, right? Their autoimmune markers are off the chart. If you ever used to, and you're like, oh wait, where do I even approach this person, right? Oh, they have Crohn's on top of that. I'm actually describing a patient once had, and they had like rheumatoid arthritis. They had like 4 or 5 autoimmune conditions, right? Like, how do even a person get there? But basically, I said, okay, this is a disease called Hu Huo Bing, right? Which means Hu Huo Bing means like a fox vermin disease or something like that, right? Or fox fusion disease. But the actual treatment is just based on a formula called Gansao Shishintan, right?
Mm-hmm.
Gansao Shishintan. And so I identified this person had the disease, and lo and behold, they got better. I didn't even have to necessarily think too much. All their symptoms made sense to me. It points to this disease. I gave this formula, and they got better. And so what
Right.
I'm saying is to identify the disease and all
Mm-hmm,
those. I didn't have to think about patterns and stuff like that. I just
mm-hmm.
identified the disease.
From a classical perspective, I
Yes.
say, interesting, interesting.
And so
Ah,
what I will say is to try to begin to understand what a disease is from a Chinese medicine perspective.
wow, that's simple and complex, you're right.
Yes,
You
more
can take
complex.
that very, very far. Oh. Well, I wanna thank you. Now, if people wanna reach you, you have a website, Nirvana Acupuncture, you, practice in the Chicago area, and, you also have a very interesting Facebook page. That's how I found you, with lots of engagement, and you're answering questions for people, and very, very little videos. It's very interesting. So, um, I I hope you'll continue to, offer that to people. And I want to thank the American Acupuncture Council again for sponsoring this.
Thank
And
you.
my name, Virginia Doran. You can catch me at luminousbeauty.com, see my website with workshops and DVD and all sorts of things. And next week, the host will be Sam Collins, who always is really practical and a great guy. So thanks again. We
Thank you.
will see you next time. Right?
Thank you.